Yesterday, while I was on 300 Air New Zealand flights flying up here from Invercargill, and you think I'm joking, I know some of you were from down there too, there was 3 and every single one was like the whole way. By last night I was exhausted. I just looked at the air hostess and I heard her conversation. I thought that'd be brilliant. And she said, thank you for choosing Air New Zealand. So I'm going to say thank you for choosing MSD. We appreciate you had competition and other alternatives you could have come, so you came to see us. So that's awesome. I'd like to introduce myself. My name's Kim Kelly. I've been a technical advisor for MSD Animal Health for nearly 2 years. Previous to that, I was a veterinarian in predominantly Southland for nearly 14 years. So I have got my hands dirty plenty of times before. My assistant co-presenter is Joanne Chisnell, same situation, although Jo actually has been a dairy farmer as well before she came to industry. So she was a vet, worked as a vet and then became a dairy farmer, and now she's also I'm the South Island and Jo's one of the North Island technical advisors. Also we've got at the back, there we are, two Linda and Talaya, who are wearing the nice green overalls, who are territory managers. Linda's a South Island territory manager and Talaya this is her local area. And also we have Sarah Homewood, who is the dairy brands manager. So there's 5 of us here. Please feel free to ask us any questions you want during the presentation. We'll get it going. If you wonder why I'm holding this, it's because I'm being recorded. So if I do a very spectacular face dive, I apologise. I'm going to try not to. And I'm also going to keep my language clean. So, as well as I can. So we're here to talk about endometritis and dairy cows specifically, and excuse the picture, but yeah, be clean and cycle madly is what we want your cows to do. A few of you who know me, I'm actually sheep, beef and deer vet. That's my passion. You're suddenly going, why am I sitting here in a room full of dairy ladies? I am a dairy farmer. I have worked as a dairy vet for sort of 8 years. I am a dairy farmer, and I'd like to show you a photo of my herd. That's her. This is my whole herd photo. Her name's Rosie. She's a very spoilt, well-loved pedigree, well, not really, Jersey cow she's a second calver. And you can see the beautiful sunshine in Southland. I just wanted to point that out because this week while I'm up here in the rain, it's beautiful down there. So, anyone in the room a share milker? Hands up if you're a share milker. I'm a share milker too, and I would like to show you who I share milk with. Her calf. I'm busy driving around the countryside doing presentations to ladies like yourself and a lot of farmer meetings, etc., talking to vets. So I can't milk my cow every day, so he helps me out. So he is currently about 3/4 of her size. He really needs to be weaned, but if he gets weaned, I get no milk. So we share milk together, different sort of. Sorry, weak joke. If you don't want jokes, you might as well.
By the way, he's for sale.
And he's for sale, yes. When I wean him, he's a Highland cross Jersey. He's been castrated and dehorned, and he's just gorgeous. And I'm going to sell him in June when I dry her off. So there you go. Back onto the serious stuff. You may notice under all these very exciting cloths, we have some real uterine tracts from real cows. We want you to get your hands dirty today, but before I'm going to give you a bit of theory and background as to what you're going to be looking at. Just one request is when you do come up to the tables, please don't lean on these trays or you will get catapulted uterus flying towards you, and the Millennium Hotel staff will not be very pleased with us. So we'll come back to that later. So I'm going to talk about cows. I did actually notice there is a man in the room. Now normally I did say to the ladies, this morning I said we're all girls in here. I'm going to talk about hormones, I'm going to talk about uteruses, and I'm going to say the word vagina. So for the man in the audience, I apologise if you're offended by the word vagina. If you're offended by the word vagina, I'm sorry, but I am going to refer to hormones as being something that we all have, uteruses that a lot of us have had, some still have, some don't still have, so we'll generally try and stick on the cow subject. Bit of anatomy, rectum and vulva, vagina, okay? You know where it all sits in the pelvis. The bladder is really important. The cervix is a tricky little thing. We'll come back to that later. And here's the uterus here, which consists of 2 horns and a body. And at each end of each horn is an ovary. That, in essence, is the entire reproductive tract of a cow. Here is a bit of this one has been removed. This cow is no longer alive. We can see the the cervix. So if you look at this, I've managed to make those in the same orientation, so you can see that we have the cervix here with the rings, a body of a uterus, a horn on either side, commonly referred to as left or right. Not often, you can flip them around a bit, but yeah, generally one's on each side. And we've got an ovary at the end of each horn, okay, connected with an oviduct, sometimes known, and especially in humans, as a fallopian tube. So this is the basic essence, and the broad ligament is, you just can see here, and you'll see on some of these tables, is what holds it in place. It sits in there in the pelvis quite nicely. If it wasn't, heaven for the broad ligament, it might swing around a bit much, so we wouldn't want that. So that's basic what it is. The ovaries of cows and the ovaries of people are all the same, have lots of lumps and bumps all over them, okay? And I just want you to think about the names of two lumps and bumps. One is the corpus luteum, which always gets called the CL. If you hear your vet or someone or AO technician talk about a CL, it stands for corpus luteum, which is Latin. And I don't know what actually it's Latin. I should know that, but I don't. So the crater thing I'm going to come back to later. There's a reason I'm calling it a crater. And this is what they look like on the ovary. So they're a hard, very fibrous structure with lots of content. The other thing I want you to know about is the follicle, which you can see here. Sorry, the light's a bit difficult, but you can see it as a fluid-filled structure, and in the middle of that is where the egg is. So those are the two structures that are really important on ovaries of any species, really. When the cow's on heat, it's what we say when she stands to be ridden by her herd mates or by a bull. Has everyone seen what a cow on heat looks like? Okay, cool. It's not because they're hot. I do have a townie cousin who said, what's this heat thing? Is it like, do their temperatures go up? They kind of do. But no, I said it's not to do with their body temperature, it's to do with the fact they stand and be ridden. So it happens every 18 to 24 days, average of about 3 weeks, which is easy for us to remember. And the main reason, there's two reasons for cows to stop cycling. The most obvious one is that they're pregnant, and I often as a vet got called to a farm to a lot of non-cyclers, and one of the most funny, awesome reasons, especially when the farmer was sure she was a non-cycler, was because she was 6 months pregnant. And the bull that he put in the winter, when the cows were dry, all broken, it wasn't all happening. So if she stops cycling, if she's pregnant, she'll stop cycling generally. The duration of that heat varies, but about 15 hours. So that's really important to know as far as people who do AI once a day. And the next slide, which is when the ovulation occurs, is at the end of the heat. So when your cow is standing and being ridden by the bull, let's for example say a bull, she's not ovulating. The coal face is having all the activity, but the ovary isn't actually ready quite yet. The standing heat is a very clever mechanism where the cow convinces the bull to mount her, and the sperm he's got will last for 12 hours at least. Takes it a bit of time. I can say, sorry, I offend the man in the room. Sperm are pretty dumb. Takes 4 million of them to do, and only need one, but 4 million of them working their way up, and they get a bit lost and they go the wrong direction and they're swimming around. So they need plenty of time to get to the place they need to be. So the cow knows that, and she said, right, well, if I come on heat 6 to 8 hours earlier, those useless sperm will get there at the right time. So think about that. Hormone variations. Now, all of you ladies, hormones, love them, hate them, whatever. There's two hormones I want you to remember today. One is an estradiol, which is a very strong estrogen, and one is a progesterone. Okay, they work in two different ways, and they're both pretty important. So look along the bottom of here, 21 days is the estrous cycle I've talked about, and up here the amount of hormone. So first of all, look at this bottom line. So that's the estradiol. Where it's a peak is when you're going to ovulate and be in just remember I just said before ovulation. So here's estrus, standing heat here. This is what the cow's doing. Her estradiol was at its highest in this cycle, okay? On the opposite side of that is progesterone, which there's an estrus, a standing heat, and her progesterone is very, very low then. So low progesterone, high estrogen equals that. So it's pretty unlikely to have high progesterone and high estrogen at the same time. They work in different ways. Okay, so the CL, the crater of the volcano, produces the progesterone, and this is something that's produced in other places in the body. Just want to clarify the layers of the uterus. So the uterus has got, this is a cross, I've opened that up so you can see, but what I've done, imagine I've got one of these horns of uterus and I've turned it side on and sliced it. So this is this picture here, and you can see there's 3 layers to the uterus, okay? This is the whole uterus. So the inside one that we're going to talk about mainly today is the endometrium, endo meaning inside, which is this big. There's a lot of it, that's all endometrium. The next layer is the middle layer, and perimetrium, which is the outside layer. Remember, the perimeter fence of something is the outside. So those are how you can remember the 3. And we're mainly going to talk about the endometrium, which is the inside. This is where the muscle is in that bit. Some infections persist, and so you get these low-grade bacteria that are in there. They increase in number and they hang around. And this is what we're going to talk about. The really filthy, pussy ones may not, they'll get sick and you'll treat them with something else. We're more interested in these ones that that are a bit more subclinical. You won't notice the massive amount of discharge. And what happens is, if you notice there, it all went a funny colour. So we're talking about the inside of the uterus. And often that's what you see. Her lining of her uterus has some problems. And you put your hand in and that's what you might find. So some cows have a higher risk. So RFMs, difficult calvings, downer cows, metabolic disease as well. Just cows with a discharge become an at-risk cow. Well, I haven't got a photo of inductions up there either, but induction cows are thought of as an at-risk cow, and they're more likely to get endometritis. However, I've said that at-risk cows are more likely to get it. Cows that aren't in that at-risk group can still get it as well. So this was a study that was done in 2009 in Australia, and of 300, on this particular farm there was about 1,600 cows. There was 300 at-risk cows, and of them 28, when they checked them, had endometritis. However, of the 1,300 that weren't at-risk cows, they still had 19%. If last spring you were a cow that had a retained cleaning, for example, you have a 23% chance of being dry next calving. So what happens with the endometritis is you get delayed cycling and ovulation, as well as you've got the direct effects, which are further on. So the sperm and the very clever sperm that I talked about earlier, and the eggs, it's not a nice environment for them to be in. You do get fertilisation, but then the embryo dies, it doesn't implant, there's something going on that stops it doing what it should do.
Everybody else knows, you don't know what this is? Cool. This is called a metric checking device, and what it's designed to do. When you get to count.
Young 20-year-old guy who was helping me out, and if you ever need...
No, they're still touching, I think.
Oh, they're coming. Okay.
Yeah, sounds like I've been there before and I'm thinking, hang on a minute.
No, you stop.
Pregnant, just like females have mucus plugs. So it's in it until the cow's got endometritis. It's not having it,
There was a young guy helping me out because they just had the whole... Just through the cervix. Yeah, we said that.
when you're trying to pass it to pet, whether it's for curing or AO, you might probably look something like that. I've never. Okay, so her cervix is that lovely looking like this. So we have ones that look very similar.
Horns, which are these curly bits here, and those are the ovaries. That big, back to something this big in 2 weeks. Calf or a heifer calf, and I thought it was an interesting question. So it says, here's the uterus, the horn of the endometrium, yep, in the middle layer.
Material, you know, these fibrous rings that you have to negotiate through to actually pass that pipette through.
There's that little phrase sitting on there.
Over to come in here. So this is nice and smooth, and as soon as we get up towards the cervix, which is this
Here? Yes, yeah.
So sometimes when a cow...
so then the other here.
I would say she got there.
What's the technique with this?
So it needs to go in this.
So who trained you?
I did it through CRB.
Yeah.
Yeah.
So you still doing it?
No. So you can either have
Tissue, poo and in between.
Okay, ladies, well, I hope you enjoyed that. Certainly we enjoy putting it together. It's really interesting. A lot of people seem to get a lot out of it, and certainly we're quite happy to go through. The tracks will be here for a little bit longer this afternoon, so we can answer some more questions if you think of any. So I'm just going to talk a little bit more about endometritis specifically. First, before I start, Kim put up her pictures of her sheep, and to be fair, that was a pretty poor job with that cow. I mean, one cow does not constitute a herd. So I thought I'd put a picture of me looking young and happy, milking cows. Kim reckons I've aged. I don't know if it was the cows or if it's maybe this job or working with her. But certainly all of the above. But yeah, that was me once upon a time a few years back milking cows. And certainly as a veterinarian, getting experience on both sides of the fence is very, very valuable to how you talk to farmers and understand what farmers are after and what they want. Some days all I could get done was milk those cows. That was the sum total of my life. As you know, when things aren't going well, the most important job you can get done is milking the cows. So very good for you as a veterinarian to do that side of things as well. So endometritis and how it affects your fertility of the cow and the financial loss that's going to be happening as a result of that fertility being affected. So this is all, a lot of what is in your brochures is I'm going to go through. Endometritis, as Kim pointed out, reduced conception rates, okay? Increased time for that cow to actually get in calf. Most of the time it takes days to conception is probably increased by 2 to 3 weeks to get in calf, and I've got some numbers to show you shortly, and that really leads on to decreased days in milk due to a prolonged calving. So they're not getting in calf as quickly, they're not calving in the right time next year, and so their days in milk is reduced. So that's a cost to you, and that really leads on to being a decreased productivity on every dairy farm. Empty cows, obviously that's sort of the ultimate is the empty cow that happens as a result. Tends to be 10 to 30% higher in endometritis cows. They tend to 10 to 30% higher empty rate. Late cows, as I talked about, 2 to 3 weeks later getting in calf, therefore 2 to 3 weeks later calving. Other costs. What other costs could you think about that that endometritis might be costing you? Not related to empty cows or late cows as such, but what other sort of costs could you think of that might be happening?
Reduced milk production.
Yep, reduced milk production, obviously, if they're not that well. Most of the time, the endometritis cows generally tend to be what we call subclinical, so they're not probably going to be that off their milk, but yes, certainly the sicker ones would be. Yep. Other thing I think about with those is less AB calves. Okay, so if they're getting in calf later, chances are they may get in calf, have to get in calf to the bull, so less AB calves. Reduced sort of culling choices, obviously, is a big one, and that if you've got those cows that are empty or late, you've got a reduced culling choice within the herd. Those are sort of the things we think about, and we think about other costs. So overall, it costs you money. There is a work sheet in the book, and I'll run through that shortly, just to give you an idea about some numbers. Endometritis cows on the right versus non-endometritis cows on the left. So certainly probably in the order of about 10% difference in terms of these pregnancy rates after calving, after mating, 6 weeks after mating. So you're probably looking at about 10% difference between all these parameters. So it does add up in terms of cost to you. Just to put this in perspective into a 250 cow herd situation, studies have been done and they've looked at the overall rates of endometritis in herds. Probably 20% would be not far wrong in most cases, 20% of the herds. Certainly a lady was talking this morning was up there that rate, wasn't it? And so in this case, even if we take a 10% rate of endometritis in the cows, that's the sort of numbers you'd be looking at. So if you have 250 cows, 25 cows having endometritis, 5 will be empty and 20 will be 2 to 3 weeks late getting in calf. And there's some figures in your wee green booklet there that just works that calculation through to give you some idea. That doesn't take into consideration the costs of your fertility treatments and other things to get those cows back in calf. If you want to know more information about some costings, we can do that at the stand. I've got a good cost calculator there as well, and certainly that may be worth just having a look at what endometritis could be costing you and your herd. Everyone asked about what the treatment costs. It does vary a little bit, but certainly that's sort of what we usually, the treatment, the actual tubes, so the Metricures, which we'll talk about $20 to $25 per tube, and that doesn't really include putting them in, so it does depend a bit on vet time and those sorts of things. Return on investment is very good though. Treating these cows is worthwhile if you treat them in a good early fashion, in a timely manner, which I'm going to talk about too. So your return on investment, anywhere from 4 to 1 to 20 to 1. Okay, so you do get your money back, but it's important that you're doing this treatment at the right time. The longer the infection stays in there and is in that uterus, the worse the reproductive performance of the cow becomes. So this graph here, Actinomyces pyogenes is one of the main bacteria that's causing infection in these endometritis cows, and this is just looking at when this A. pyogenes was isolated and then percentage pregnant as you go along. So as you can see, the longer that Actinomyces pyogenes is actually in that uterus, the more effect it has on pregnancy rates. So you need to be, this is when we're talking about when we're actually diagnosing and treating these cows, it's important that we get in a timely way. So what do we do? How do we find it? Now, Linda's had a station down the back and she's been showing you the Metra checker, which is great, and we've developed some pretty good tools over the years to deal with things. We haven't quite got to this stage. If I could have a van that rocked up and told me that that cow over there had endometritis, it would be easy. It'd probably have all the vets out of a job. However, we have vastly improved on what we used to do. Who remembers how we used to check for endometritis? Does anyone remember what we used to do before we had the wee Metra checker thing? Okay, it used to involve one of these, which is a poorly focused version of a vaginal speculum. Okay, so it used to involve one of those and it used to involve one of those. Okay, now we're supposed to be smart as veterinarians, we're considered intelligent. However, this was fraught with issue. Okay, so what you've got this end into the cow, into the vagina of the cow where there's probably pus. If you're looking for it, you find it. This end has your eye attached to it, okay? And up here is a rectum full of shit. And to be honest, it was really fraught with error. All that had to happen was the cow to cough badly at the wrong time, and you either ended up with pus or shit or both all over you. So I'm pleased to say we now have a much better way of diagnosing endometritis. Thank goodness for that. I said shit, Kim, I'm going to be in trouble on that video. Okay, so we have the Metra checker, and to be honest, these are the most simple things around, but they do a really good job. To be fair, they're very, very good at picking things up. When we had the old speculums, like I say, you were dodging crap and everything else, and to be honest, I think sometimes you didn't really have a good look. And these things, they tend to be quite good at what they do, okay? And they're very well tolerated by the cow. A lot of people will use them just at a milking time, no problem at all with actually just going through and checking, okay? And certainly they have made life a lot easier and made it easier for us to check our cows and check our whole herd.
Can I ask a question?
Yep.
Who invented it?
A guy, actually.
Oh, a guy, yeah. A vet, a male vet.
I know, it's incredible to think of. A male vet who was about a year senior to me at vet school. His name is Garth Riddle, and I don't think he actually did as well out of this thing as he could have done.
because he's still working as a vet. Yeah, it did. Yeah, squash ball. Cut it in half and he whacked it on the end. Yeah, it's a very, very simple thing, but yeah, he's still working as a vet, so I'm thinking he probably didn't do as well as he could have done. I still don't think he's worth millions. But anyway, so the moral of this story is when you pull these out and you're looking at the pus that's on the end of these things, or the contents of what's in the wee cup, any pus is bad, so any small flecks that you're seeing through there is, really needs treatment. More pus is worse, okay? So sometimes we do a bit of a scoring scale on these. You can see here, so yes, I just wanted to put some pus up because I didn't think we'd seen enough gross things today. So here we've got probably more like a score of 1, working through to sort of more 2s and 3s and 4s when you're getting up to this stage, okay? So a few flecks, and certainly the reproductive parameters when you have this, so your fertility is a lot worse in this sort of cow than in this sort of cow. However, still treating those cows is worthwhile. Okay. What do we do? So when we find that pus, we then treat with Metrocure, and Metrocure has a pretty good cure rate. It has up to a 93% cure rate 14 days post-treatment. It works, it's a very broad spectrum drug. It covers off the main bacteria that are going to be causing endometritis, and I'll just take you through what it's doing from the point of view of how it acts in the uterus, and I'll do that shortly, this one here. So when we pass the pipette through, as I showed you guys on the station here, release the contents of that syringe, and what that's doing is it's putting that antibiotic into where it's needed, and then that maintains an effective concentration into the drug into the uterus for about at least 72 hours. Okay, so this line here is the concentration of drug required to kill this bacteria. Okay, and then when the drug is released into the uterus, that concentration peaks and then slowly drops off, but it still maintains well over the MIC out to 72 hours, okay? But what it's doing in the blood is quite different, okay? So it's a really local thing that you're doing. You're putting antibiotic in there, but it's really not going through into the bloodstream, therefore you don't have a milk withholding. Okay, so it's really quite a local action. To have a milk withholding, you would have to be that antibiotic would actually have to be getting into the bloodstream and then getting into the milk. Okay, so that's how it works. Treating earlier gives better results. So we talked about the fact that we should be treating at an optimum time. Now it used to be that we used to treat our at-risk cows and we'd just put those up, and as Kim talked about, you may be actually missing up to 2/3 of your endometritis in your herd if you're just looking at your at-risk cows. Okay, so nowadays we talk about doing the whole herd, and it's important with the timing of this. We talk about treating or diagnosing endometritis in this 2 to 4 week window post-calving. Okay, the reason for that is that when we get out here past out to a sort of 4 or 5 week window, the uterus is actually what we call involuted, and it's contracted down, the cervix has got quite closed, and sometimes there may be pus in that uterus that we're just not seeing by any, we can't see with a metra checker, we just can't find it, okay? They may still be dirty and they may still have problems with getting in calf, but it's really, really hard to diagnose and treat it. Also, in addition to that, as I showed you before, that bacteria, the longer that bacteria stays in there, the more damage it's doing. So to do this, to treat in this window, requires a bit of planning. I had a lady sitting down here this morning and they do them in 5 different batches in her cows, and she works out when they're doing them so that she's not only doing her at-risk cows, but she's doing her whole herd within certain batches, okay, so that she's actually maximising her chance of, this drug's not cheap, but it's doing a really good job if you get in there and do it early. So, for your at-risk cows, how many of you guys form an at-risk cow list? Yeah, okay, so you record who your at-risk cows are, and then what do you do with them? When do you check them? Yeah, and that has been the historical thing, and a lot of those cows, some of those early ones, are going to be well outside our optimum window for treatment. To do the best job on these girls, to give them the best chance of cure, and to diagnose them the best way, really what you should be doing is doing them actually up to 4 weeks post-calving. Okay, and that's really just it's been quite well proven that the cost benefit of doing this is a lot greater than leaving it till that time closer to AB. Okay, so it may be something to consider how you would actually go through doing these in batches. Same with the herd. If you were going to do the herd, again within that ideally 14 to 28 days post calving, if you're going to do the herd, just bring it as far back as you can, so closest to calving as you can. Okay, it's really going to maximise your treatment, your results to treatment. Yeah. So just to summarise, endometritis is really common. We do see it a lot. It's probably underdiagnosed if you're not checking your herd. It's going to cost you a lot of money. And if you are using Metrocure, try and do it, as I say, earlier to early diagnosis and treatment gives you better returns. Okay. So before there was there was no gentleman in the audience this morning, and I said we need to see. There's not many of these around today. Well, not many wallets, but not many male bottoms. But certainly an early check at this end here could mean a larger check on your pocket. So consider that when you're thinking about what you're doing with your metro checking this year. And certainly the first step, if you don't do an at-risk cows, do your at-risk cows at the very minimum. Questions?
I have one. You said the 14 to 28 day window.
Mm-hmm.
You say you wouldn't check a cow at 10 days?
You could do, yeah. I mean, it depends how hard you're stretching them out. The reason for not doing them too close is sometimes they can have a little bit there in that sort of really early after calving period that can be a little bit hard to actually work out what's going on. So the 14 days comes in as more of a just, okay, by this stage, if they were going to have pus, it's going to look more like pus than just a bit of, post-calving fluid. So you could, I wouldn't be too worried about that if you were sort of coming in with your metro check and you said, oh, well, I might include a few more just to try and make it a bit easier. No problem at all. Yeah. Yeah.
After you've done your checks and you've used Metrocure, how long after that would you check again? Or do you check again?
Yeah, I mean, what I would do, yeah, exactly. I would probably be checking every if you're doing them every sort of 2 to 3 weeks, check them again when the next group's up to be checked. Okay, so put a note on those, especially some of those ones that are really pussy. Okay, I mean, they're pretty good success rate. Occasionally you might want to use another treatment. The odd time that you're starting and they're just not clearing, then you've sort of got to sort of weigh up the cost benefit. But usually, 1 to 2 treatments is going to do the job, 1 in most cases. But certainly checking them if you're going to put them up again. If you've got say 20 that you did 2 or 3 weeks ago, put them up with the next 20 or whatever you're doing. Yeah, yeah.
There must be more questions. We've got like 10 whole minutes for you ladies. This morning we didn't have enough time. Sorry? Hereditary.
Not probably really.
Very good question. Very good question.
It is. There may be some aspects of her conformation that would make it hereditary. If you've seen those ones with the vulvas that basically sit underneath the rectums and they're sort of basically an open sink for collecting fecal material. Yeah, that was hereditary. Some of them have poor conformation like that. Apart from that, probably not a lot. Yeah, yeah.
If you check them after calving, would you bother doing it again before mating as well?
Not really. If you've gone through and done them, yep, you're pretty, I mean, as long as you've done a good job with the metro checker or whoever's doing them and gone through them and they're happy they've done them, then no, you're all good. It's just really having a think about when you're doing them for that optimum time to get them right. And certainly there's some good science around actually bringing that earlier. It's always been a thing, we'll do them just before mating. To be fair, when we're doing them pre-mating, they haven't got a lot of time to get right. If you've got a pus-filled uterus in there, it does take a few weeks for that to settle down. And certainly they're not going to conceive and hold if that's still around. So you want to give them time to do that, but you also want to give them not too much time being infected because you just have less chance of cure.
How likely are they to get it the following year?
Good question. Yeah. Depends on what the cause was initially. If they were calving issues or retained fetal membranes or anything like that, calving problems maybe a little bit, they've got a increased chance of getting it the following year if they're prone to calving issues. But yeah, generally I don't think it's a massive link as long as they've cleared and they're back to being good again. Yeah.
If you had carryover cows,
Yep.
I mean we haven't, but if you had carryover cows, you would try to check at least 6 weeks or
Yeah.
8 weeks out.
And before wasting
then
your,
if
yeah.
they had pus,
Yep.
then we'll-
Because the other thing is with them too, you can also check if the vet was doing it, or if you're depending on who's doing it, just to check that everything else is all right in those carryovers too, just to make sure there's no adhesions, no major problems with that uterus, and for any other reason that they were, the carryovers in the first place. Yeah, yeah.
Can I ask if we occasionally get ear suckers sucking the ear,
Yep.
ear through the vagina,
Yep.
and they catch all that fecal.
Yep, they're more likely. Yep, they are. I mean, that is a confirmation fault. Now, sometimes it'll be caused by calving damage in the past. Sometimes, as we talked about just before, it's just a straight confirmation that they've got a, they for whatever reason they're an ear sucker. Horses get it too, and with horses you actually spend the time and the money if they're good breeding mares and actually do what you call caslick and close off they stitch together the vulval lips so that they can't get a lot of contamination in there. But with cows, you probably could. I haven't, it's not something that we do regularly, but certainly it's a more prone to having, especially vaginal infection, and then that will often, if you have problems, lead on to, uterine infection as well. Yeah. Yeah, you can. I mean, it doesn't actually have any effect. Some people will treat them straight away. So I think what we've got in our thing, you can treat them sort of 6 to 8 hours later with Metrocure. I don't think it has any effect on the actual sperm. What you're trying to do in that case is the ovary's still probably about to ovulate, or it may not have ovulated yet, and it's going to take a little bit of time for that egg to transfer down the fallopian tube and actually hit the uterus. So what you're trying to do is you're trying to create a sterile environment prior to that egg getting in there, and that's where the Metrocure can come in, and that has been shown to help by doing that, because the odd time you're right that they'll pull out the pipette and they'll go, oh, she's quite pussy, and bang in a Metrocure. And
You ask them really nicely if they'd please mind popping this in for you.
yeah, yeah,
Usually they will.
yeah, they do. Yeah, that's cool. Yeah. Speak nicely to your AI technician. Yeah, that's right.
Any other questions?